Patient-family engagement has become really important, particularly in the last several years, because of the drive towards improving outcomes and holding providers accountable for patient health, patient outcomes, and patient experience, as well as the move towards patient and family-centered care. I think about patient and family engagement as a concept that is really rooted in partnership. First of all, it's engagement in my health and my care. And that means things like moving away from figuring out what kind of disease the person has to what kind of person the disease has. That's something that is much more person-centered and family-centered and much more holistic in understanding who the person is that you need to now collaborate with to achieve better health and wellness. I also think about it at two other levels. The second level is engaging patients and families in designing the system itself, in creating a system that really works for them. For decades, we've had a very provider and payer-centric model, and we're moving towards a more patient and family-centered model. And that means we've got to really partner with patients and families to figure out how do we build the system in a way that meets their needs and that gives the experience that they're looking for, that enables them to get better. And only they know the answers to that, right? And then the third thing is partnering with patients in governance and how we govern and monitor and oversee the system and hold the system itself accountable for delivering the kind of care and the kind of experience that patients and families want and need, that also works for providers and clinicians. One of the most important things that providers can always keep top of mind is that patients and families should be considered central members of the care team throughout the care process. And that means engaging them as full partners, just as you would other nurses or MAs, et cetera. And to do that, often patients and families aren't accustomed to being welcomed into that role. We spend a lot of time in healthcare sending them many, many signals that healthcare providers are very busy and don't have time for questions. And we send them lots of subtle signals that say, you know, you're not really welcome to be active and fully participating in this process. And that's not only flat out wrong, but it's also very harmful to the care process and to health outcomes. And it's less satisfying for clinicians and staff. So we should always remember that patients and families are essential members of the care team. They are very unique resources that have information that only they can contribute, that is very material to the care process. And it is essential to both invite that participation and welcome the response that you receive, no matter what it is, so that patients and families really become accustomed to those roles going forward. They say things like, this is why I went to medical school, or this is why I became a healthcare professional, or this is why I went to work in this hospital, because it enables them, that kind of partnership enables them to build a very satisfying relationship with patients and with family members that is a two-way street, and it is inherently much more dynamic, and it is bidirectional and very rewarding. So we hear a lot that healthcare providers really enjoy their work much more when they can come to the care process with this lens of partnership and collaboration. Patient and family engagement is making a real difference. Certainly engaging in care. Research and science shows us that when patients and families are engaged in a meaningful partnership with clinicians, where they're able to go back and forth and discuss treatment options and the benefits and the drawbacks, and really bring their life circumstances into the discussion, their goals, their values, and their preferences, then outcomes improve. The last thing that I would say about patient and family engagement and what's important to remember is that we need to stop viewing patients and families as the other. We're really in this together, and healthcare professionals have a unique skill set and knowledge that we as patients and families don't have. And we have the same. We have a skill set and knowledge and a viewpoint that you don't have. And it's absolutely essential to understand that I, as a patient, cannot get healthy and well or improve my quality of life without what you have to offer. But you can't thrive as a healthcare professional without understanding and leveraging what I have to offer. So we really need to come together as partners and recognize and leverage the unique strengths that we both bring to this common table and use that as a collaborative tool and process for achieving better health outcomes, lower costs, and better patient experience.